Know that 9 out of 10 childhood poisonings occur in the home? We want to remind you to get rid of unused or expired medications in your home.
For nearly 70 years, Fruth Pharmacy has been dedicated to medication safety. We are partnering with the WVDII to help spread the message, don't keep Rex around.
Get rid of unused or expired medications in your home by visiting a Fruth Pharmacy location for your free medication disposal bag.
DisposeRx is your simple, convenient, and effective at-home medication disposal solution. In a few easy steps, you can safely and easily dispose of your unused or expired medications in the comfort of your own home. First, remove the prescription label, or use a permanent marker to cross out the important information on the vial. Then, open the bottle and fill it 2/3 full of water. Empty the packet of DisposeRx into the vial, replace the cap, and shake it for 30 seconds. Almost immediately, you will no longer feel or hear the pills rattling in the bottle, as they are being sequestered in cross-linking polymers that render the drug unretrievable for all practical purposes. Then, throw the vial in your household trash. DisposeRx allows you to maintain your medicine cabinet by promptly and properly disposing of your unused medications. Simple, convenient, effective.
Gentleman by the name of Bob Calhoun, who is the assistant superintendent for Kanawha County Schools, just in passing had mentioned to me, we'd really like to develop something for preschool. I happened to be working on a few other things with Joe Murphy, who's the CEO of Murphy Media, in relationship to opioid prevention and education, and had mentioned to him, hey, what do you think about creating something that could be applicable to the pre-K environment?
Get to the older ones, sometimes they've already got this mindset of, bad habits, because they see what's around them, and, you're unfortunately sometimes a product of your environment, and if we get to them early and they start learning good habits, the earlier the better.
Never imagined that within 4 or 5 weeks we would have a talking avatar that could interact with the children in real time, and we named him Rex the RX.
Have you been telling Mrs. Webb in her class all about, this?
Yeah.
What's up with this?
What's that?
It's cat. Oh, that's pretty cool, huh? Don't you wish you had one? I bet Joshua wishes he had one. And what about Temperance? Hey, Temperance, do you have a hat?
Said you have a hat.
Blake.
He's not gonna high-five you or give you a hug. He will interact with you, but the whole purpose of Rex is that we don't want the kids to keep Rex around.
Oh, guys. Bye.
This is the way, in my judgment, to reach them. They're used to being interactive, and they really don't respond to anything but that. So you've got to find a way to make that impression and make it last.
Hey guys, what do you think of my hat? You like it? Anybody here wear a hat? No?
Kids like Rex because he's also interactive, and he can, communicate in the actual classroom, so you can say the kids' names, and that gets their attention immediately.
The response has just been amazing. The kids really relate to the avatar, so if they do have a prescription medication that they take, which a lot of kids do, we want them to use that medication properly, but we also want to ensure that they're not sharing medications. We know that we have an enormous amount of children living with grandparents, living in foster care. We know that grandparents, that age group, they're more likely to have multiple prescriptions where they probably shouldn't be, where they're much more accessible.
So it's a short program, but it's very effective, and Rex can talk to the kids, answer questions with the kids, and give them vital information.
Technology was used, it was very interactive, and the kids really, really seemed to enjoy it and learn a lot. I mean, medication is not something that we talk about a lot with kids at all because you don't know where to draw that line, but this made it very kid-friendly and interactive.
Do you know what that means? He's expired.
Hey, hold up a second there, Susan.
And so the message of don't keep Rex around is a real poignant one and real important, and something that a 4 or 5-year-old can kind of wrap their arms around and understand.
So we were really making a difference. We were reaching more schools and more counties and more kids than we ever had before with the medication safety message that Rex shared. And then in March of 2020, just like the rest of the world, the Rex program really came to a halt. So we were all working together and trying to figure out ways to get the program back online in any way, shape, or form. And then kind of hit the pause button and realized that now the message was even more important, because you had all of these children who were at home with parents and grandparents who more than likely were not storing medications properly, and that made medication a lot more accessible and the message so much more important. We went back to the roots of Rex, which is innovation, and we found a way to scale the program by bringing Rex into homes remotely. And what that did was it opened everything up to a very unintended audience of parents and grandparents and caretakers who started to engage with us and their children about the importance of medication safety. We continue to believe that the message of medication safety is important, and that's for any medication. It doesn't have to be an opioid. We know that medications can be very dangerous if not taken by the person that they're prescribed. We also know that most children who overdose on a medication accidentally ingest that medication because it was not stored properly. We know that most people who become addicted to a medication do so because they obtain that medication either knowingly or unknowingly from a friend or relative. It's something that we really thought would delay or derail the program, and our message about medication safety really turned out to be something positive in terms of being able to reach more people with the message, because in the end, it's really important that no one keeps Rex around.
Good afternoon, everyone. Welcome. We're very glad to have you joining us live. We're coming to you from downtown Charleston, West Virginia at the West Virginia Drug Intervention Institute. And I'm Dr. Susan Bissett. I'm president of the Institute, and we're having a very important conversation this afternoon about medication safety and disposal. Our mission at the Institute is very simple. It seems simple, but it's a very big goal, and that's to reduce overdose deaths in West Virginia. We do that through prevention, education, and outreach. And so our live events are one way to educate persons really throughout the world about the importance of medication safety and safe medication use. We have a golden rule here at the Institute. It's called Don't Keep Rex Around. Rex is short for RX, which is an abbreviation for prescription. And we want to, of course, remind everyone every day. I think there's Rex up in the corner there coming to say hi to me. But we want to remind people not to keep expired or unused medications in their home where it can be misused or ingested accidentally. So we'll be talking a lot about that today. And we have 3 very special guests with us this afternoon, and we're going to bring them in one at a time, but I can let you know who they are. And we're very excited to have all 3. One is Jim Carroll, who for 3 years served as the National Director of the Office of Drug Control Policy. We're super happy to have him here with us this afternoon. He's still doing lots of great work in this field, and so we're very excited to welcome him. Dhillon, who is here with us this afternoon as well, who has been an acting administrator with the DEA and has also worked for INTERPOL in Washington and has numerous years of public service in Washington, D.C. And then we also have William Simpson, who is the co-founder, president, and CEO of DisposeRx. And so we'll be talking a little bit more about safe medication use with each of them. And then just want to remind everyone that you can type in any questions you might have to the chat, and we'll do our best to answer those or pose the questions that you send to our panelists this afternoon. And also want to remind you to visit wvdii.org. Follow us on Facebook and Twitter. I think we're also on Instagram now, so you can probably see what Rex is up to by visiting Instagram. So this afternoon, I just want to, first of all, welcome our guests. And the first guest we're going to bring in is Mr. Jim Carroll, who, as I mentioned, is the former director of the National Office of Drug Control Policy. Welcome, Jim. Thanks for being here. I can't hear him. We're having just a little bit of an audio issue, Jim, so I think Joe's trying to troubleshoot that. Let's see if we can bring in William and see if we could get him on audio. Are you there, William?
Yes, I am.
Oh, fantastic. Well, we're gonna get Jim back with us here in a moment, but we're glad that you could tag in. That's why there are 4 of us, so we can make this work, right? So, William, you are the co-founder and the president and CEO of DisposeRx.
Yes.
Can you tell everybody a little bit about DisposeRx while we have you here this afternoon?
Sure. So DisposeRx is a company that was founded on some of the great work that you're doing, Susan, in West Virginia. The idea of removing unused and unwanted medication from the home, and what we have done is with a great, passionate team, we have built an incredible network of partners, and this simple solution is to bring an at-home solution to our patients at home. So the idea is to use a packet of DisposeRx, which you saw in your video, a very small packet, and to destroy your medication with DisposeRx when it's no longer needed or wanted.
And persons who want to use DisposeRx, it doesn't have to just be prescription medication, right? They can use this with vitamin supplements or over-the-counter medications. Is that correct?
Correct. It doesn't have to be just prescription medication. Our focus has been on what we would call medications of concern, those that might have a history of being misused. So be it an opioid or even if it was a dosage change in a medication for something that might be concerning, something that would be a risk to children. Our mission is driven on eradicating the misuse of unused medication. Historically, I've always believed in educating the next generation. So hopefully we would look at and the great work that you're doing around educating the next generation is not to have to ask the answer of how do I dispose of my medications in the future, but just knowingly have solutions, and we believe at-home solutions amongst a myriad of issues and options that are out there are helping with that education and helping with that change.
So can you tell our viewers this afternoon how that works? I've used it before and it's pretty easy, but can you talk to our viewers about how easy and simple this really is?
Sure. Yeah, we are very lucky to have some very smart people create what we think is a very elegant and simple solution. So again, it's a small packet. It's 2 grams of what we call cross-linking polymers. These polymers are listed as approved by the FDA for oral medication. You basically, it's very simply like in your video, you take the medication vial in which the medicine was dispensed. You put water in that vial, so you're adding about half of the water. You add our packet into that vial. You then put the cap back on. That's the important part because you have to shake it for about 10 to 30 seconds. And when you shake it, it creates a viscous gel. So think something between like syrup to rubber cement. And that viscous gel is the magic. That's what sequesters the medication so that it's not available for misuse.
And then if someone's watching and they want to obtain some of these packets, let's say they have medication in the home that's unused or expired and they want to discard of, where should they go to get the product?
Well, I got to say, I get very excited about talking about that part. We are very lucky to have not only a great team of people and great partnerships like with you and your associations, but also we are in and I'm proud to say 70% of the counties in the United States and over 60% of the pharmacies. So I'm confident in saying that you can get a packet at your local pharmacy. We have wonderful stewardship programs with Walgreens and Walmart and Publix and CVS and Kroger and Albertsons and H-E-B and Fruth and just a number of pharmacies that have engaged in some very important programs that are educating their patients and are working to help answer the questions that you are trying to answer, and so are we.
Well, that's fantastic. I will also say that we have recently made the packets available via our website. So if you go to wvdii.org and click on medication safety, you can actually request to have one mailed to you. So we've made that available to anyone anywhere in the United States who might want one of those packets. And then, of course, we have that wonderful partnership with Fruth Pharmacy through the end of June 30th. Anyone in West Virginia, Kentucky, or Ohio in the vicinity of a Fruth Pharmacy can go in and pick up one of those packets completely free. And we also have some educational materials with Rex, the RX on them for the kids. So I'm checking in with Joe to see if maybe we have Jim back with us.
Can you hear me?
Wonderful. We're so glad to have you, Jim. Thanks for being here. Thanks for being so patient with that little snafu.
Oh, no, thank you. And thank you so much, as William said, all the work that you do and your team every day, 7 days a week, 24 hours a day is dedicated to saving lives. And everyone is so appreciative of the work that you do. And so it's such an honor for me to be with you.
Well, the honor is all ours. And so we want to talk about your time as drugs are. And of course, one of those things that we were able to report during your tenure there was that we were seeing a little bit of a decrease prior to the pandemic. And so obviously prevention is a critical factor into decreasing overdoses. So why is it that we don't talk about medication safety or safe medication disposal as a part of that? And why is it important?
You know, I've been to West Virginia so many times, and, you know, the heart and passion of the people there are so focused on this issue. But nationwide, it is a real problem. And when you say prevention, most people think about, you know, SAD, the Students Against Destructive Decisions that are in your classrooms across the state. But really, it's much bigger than that. The drug issue in our country is so much bigger than that. And like we're talking about today, one of the real issues are leftover medications, not just opioids. Obviously, those are very concerning, but these leftover medications that are in our medicine cabinets, on our countertops, or maybe in, you know, maybe not even ours, but in the house, you know, that where our children go, or where sadly, you know, our teenagers go.
Yeah, and I of course have 2 teenagers, and so one of the things that I'm concerned about is making sure they take their medication properly, but we talk about disposing of it and storing it properly as well. With that said, how big of a problem is accidental pediatric exposure to medicine in the United States?
What a great question. And sadly, it's the #1 cause of poisonings in the United States. And the last figures that I saw a couple of years ago were about 100,000 emergency room visits. So heaven knows how many actual ingestions were, but 100,000 emergency room visits for children who accidentally took something that they weren't supposed to take, wasn't designed for children, you know, a medication for, you know, maybe an older teenager or a parent or grandparent. And so, you know, it's the #1 concern. And sadly, you know, what we're seeing with drug addiction issues being so prevalent, especially now with COVID and the rise of fatal overdoses, you know, what we're seeing sadly are some of these kids who are getting access to the drugs that are, you know, being used in the household. And I've seen so many tragedies, and there've been several just this month alone throughout the country of kids. One was 7 months old, who accidentally you know, got some of the drugs, the illegal illicit drugs in their house. and the 7-month-old child died. And, you know, the parents obviously have addiction issues. They're grieving the loss of their child, but now they're under arrest and sitting in a jail cell. And I think that probably pales in comparison to realizing that their addiction caused the death of their 7-month-old. So it's important that everyone understands that we need to have drug disposal at home to get rid of leftover medications, certainly leftover opioids, but also to keep in mind, you know, that as these drugs are out there, is to make sure, you know, that there's nothing that could happen to these kids because of, you know, sadly, what we're seeing in this country. It's important to have it laying around the house, to have, you know, a disposal solution, like William was talking about, to, you know, this is something you want to be thinking about ahead of time, is I am prepared to dispose of these medications when I get them, not after I get them. And right. That's critical.
Be ready.
Teenagers, you're busy, Susan.
Yeah, I do. I have one in college and one in high school. And so actually one will graduate college and the other will graduate high school in the same year. So that'll be a fun year when that happens. But speaking of teenagers and college students, what about them? What about older children in prescription drug misuse? What are some trends that you see there?
Yes, sadly, you know, what we're seeing is really at the high school and college level, where kids, you know, are, you know, under medication, under doctor supervision, taking a prescription, but having some leftover medications, and, you know, a friend who, you know, believes, you know, through their own diagnosis, you know, that they should be taking the same thing, but sadly, it's not meant for them. You know, it's not taking into account the other physiological differences that a physician or a provider, you know, would take into account. And so they're taking some of these leftover medications, they're, you know, can pass them, you know, around a friend group and not realize that they themselves are putting their friends in danger. That in fact, some of their friends, what we're seeing across the country, have died because these kids are innocently thinking, oh, I'm giving them something to, you know, what they think would be enjoyable at a party, and it's not, or help you study, and it doesn't. What it does is really cause a lethal, sometimes fatal overdose, and this is why we need to preach to our children so many things, but one of them is properly take your medications. If they're leftovers, to properly dispose of them. And of course, I know Uttam's going to talk about drug disposal, but it needs to be something we do every day.
Absolutely. Well, speaking of drug disposal, why don't we bring Uttam into the conversation? And Uttam, we're just so happy to have you here today. You've been on the enforcement end of this issue to some degree, because for a while you were the acting administrator for the DEA. And so I guess my question for you is, you know, as the former director, that DEA program, the drug take back days, but that happens twice a year. So how important have those events been to helping drive awareness about medication disposal and the importance of it?
Well, I think it's been very important. That program began about 10 years ago, 2010. And it was an opportunity for Americans all over the country to clean out their medicine cabinet. Someone wanted unused and unneeded expired prescription drugs, and then to bring them to a collection location. And DEA would have about 5,000 of these collection locations twice a year. It's important to realize why DEA started this. It's because these unwanted, unneeded drugs were highly susceptible to diversion and to misuse and abuse. So DEA started the program because they could see that Americans were becoming addicted and dying from opioid overdoses, prescription drugs available to them in their homes and their medicine cabinets from families and friends. So it's been really a really important program because it raises awareness of the opioid crisis every year. And it's been pretty successful. The most recent statistics were that April 24th was the last National Prescription Drug Take Back Day, and over 829,000 pounds of medications were turned in and destroyed by DEA.
Well, that is amazing, and we are very honored to have been a part of the DEA Take Back Day in April, and we were here with our team end with RexDRX, and we collected a very small amount of that over 800,000 pounds of medication. I think we had about 4 bagfuls, which worked out to be about 50 pounds that we collected right here in downtown Charleston. So very important day. We also know that many sheriff's departments have the ability to take drugs any day. But talk to us a little bit about why we need to dispose of medication either through a take back day or a drug disposal kit. Why can't we just flush them down our commode at home?
Because it pollutes the environment. And so that's another reason why DEA began the take back day. People think that's a safe way to do it, but it actually pollutes our water supply. All the drugs that DEA collects are destroyed in an EPA-approved incinerator, so it's environmentally sound to destroy them that way. But I should also point something else out. One of the things I noticed when I was the acting administrator at DEA was we're doing this twice a year, and we're collecting enormous amounts of drugs. This needs to become a daily exercise, something Americans think about all the time. There are take-back locations open throughout the country, but again, it requires people to collect things, these unused medications, and to take them to a location. The better approach would be for people to simply be able to dispose of them more efficiently, effectively within their home at the moment they become unneeded. Not flushing them down the toilet, because that's not environmentally sound, but using a safe disposal method to do so.
Like the DisposeRx packets that William shared with us. And I'll also say one of the medications that I didn't think about in my home during that drug take back day in April was veterinary medications. It's not something you think about very often, but many people like to hold on to those just in case. Right. So it's important to get rid of those as well.
Absolutely. Those can be diverted and improperly used, just like medications for humans.
Is there anything else that you would like to share with our viewers, Uttam, about medication safety or drug take back that you feel is important for them to know?
Well, look, the bottom line is this. If you're not using a drug, if it's unneeded, you don't need to save it for another day. It's best, it's safer, it's the smart thing to do to immediately dispose of that drug before it can be used, abused, and diverted, before a family member or a friend can become addicted. Our addiction crisis started in our medicine cabinets, in our own homes. So disposing safely of these drugs as soon as they're unneeded and unnecessary is a smart thing to do.
That's a very powerful statement, that our addiction crisis started in our medication cabinets at home. So we talk a lot about getting drugs out of the street, but really what we're talking about today is getting medications, whether that's over the counter or prescription, out of your home, so that those are not misused or abused or diverted. So very important point. I want to give also Jim an opportunity to share any thoughts that he would like with the viewing audience, and then we'll move on to William before we close today. Anything you want our viewers to be thinking about and have in the front of their mind, Jim?
Yeah, I think what Uttam said is dead on accurate, sadly. And, really we think about, our teenagers, we think about our kids, and we think, oh, they'll never have access to those types of medications. Sadly, what we know is that teenagers are more and more exposed to prescription opioids by dentists, by having a tooth pulled. And that's typically the first time that someone receives a prescription for a painkiller. And what we know, and what Uttam talked about, what you know all too well, is that having these leftover painkillers is the problem. And so, knowing that your children are going to have these procedures as they go, into their teenage years and go through this period of their life, it's more important to make sure that you have this at home, that you talk to your pharmacy to make sure they have that available to give you, or make sure that even the provider knows exactly and should be telling their patients, look, if there's some leftover pills, you need to dispose of them immediately.
Yeah, that's wonderful advice. And I was thinking about wisdom teeth experiences as you mentioned. You're absolutely right about that. William, we'll let you have the last word, because I'm sure there's something really important that you want to remind everybody who's listening and watching today.
Well, no, I want to thank you for all your work and really, Jim and Uttam are amazing resources and people to be working with. Honestly, it's education, as you know. It's engaging your pharmacists, it's engaging your providers, it's engaging those that are involved in your care plan around your medications to best understand your medication. And as both as you have said, and as Jim and Uttam have both have said, it's understanding is the medications that you're on therapy with are the ones that you should securely store. Those that you're off therapy with, that you're no longer taking, unused, unwanted, you should find safe and secure ways to dispose of that medication, be it an at-home solution like DisposeRx, or be it a take-back day or an event or a sheriff's department, whatever that is environmentally friendly. As I agree with Uttam, putting it into the environment through the commode is just not the preferred method. But making sure to stave off that addiction or overdose or misuse event is critical, and teaching our children how to manage and best take their medications.
Wonderful. Well, I want to thank all three of you for being here with us this afternoon. I know you're all very busy, and we certainly appreciate your time. I want to remind our viewers to go to wvdii.org. You can also request one of the DisposeRx packets that William shared with us today there. Like us on Facebook, follow us on Twitter and Instagram. Be sure to share out messaging about medication safety whenever you can. And we want to encourage everyone to start today, make it every day. Don't keep Rex around. Thanks for joining us.
Thank you.
Thank you.
At the WVDII, we believe that every home with an opioid should have a life-saving naloxone kit on hand. For your free kit and online training, visit wvdii.org.
Research indicates that the majority of students misusing prescription stimulants as study aids earn lower grades. Here's the good news. 81% of college students do not misuse prescription medication as study aids. Staying current with class material, prioritizing tasks, and accessing tutoring and online tutorials are just some of the ways you can stay stimulant-free. And remember, never share your prescription medications. Visit generationrx.org.
Hi, I'm Dr. Susan Bissett, President of the West Virginia Drug Intervention Institute, reminding you to get rid of unused or expired medications in your home. Visit a Fruth Pharmacy location in your area today for a free medication disposal kit.
For nearly 70 years, Fruth Pharmacy has been dedicated to medication safety. We are partnering with the WVDII to help spread the message, don't keep Rex around.